at 4 o'clock in the morning and, you know, you've got a 21-year-old that's intermittently having cardiac arrest at another hospital, you just go.
It was on a Sunday morning. My phone rang and it was Dr. Whitmore. He just said, you know, how fast can you be at NorthCrest? We've got a young patient that needs to go on ECMO. I jumped up, got dressed, and ran over there and walked in to find Alyson. She was incredibly sick. I knew that the quicker that I could get there and get things sort of ready to go, that when the rest of the team arrived with all of our equipment, I wanted to be able to get started and get her stabilized.
For me, as the ECMO coordinator, my job is to essentially get everybody together. So kind of all of this is happening in a big fury as all things are going while we're driving out to NorthCrest.
It was very cold. It started snowing as I was driving there.
You know, one of those few days in Tennessee when we get the snow. So we were a little, you know, leery of that.
It was about 45 minutes with the weather. We had to take sort of a weird route because we were worried about the road conditions. We didn't want to get, you know, stuck. It was intense. We rode with Robertson County EMS and they did a wonderful job. We weren't able to obviously fly, which was what we would normally do in this situation because of the weather.
You know, with Alyson, there was no way we were getting her here safely if she wasn't on ECMO and we didn't have some way to stabilize and get blood flow and oxygenation to her body. You know, she had to have some sort of cardiac support and oxygenation support. And, you know, if she didn't, she probably wouldn't have made it. It is a very specialized treatment. It is the highest form of life support. So it is not common, you know, there are not a lot of facilities out there that have it. And there's definitely not a lot of facilities that will go somewhere else to put the patient on.
I met her dad, Daryl, and he was understandably so worried. And I just remember saying to him, I know this is really scary and I know you've probably never been through something like this before, but we do this all the time and we're going to take really good care of her and this is what she needs. And he just said, you know, do what you need to do. So then to go to the reunion and see her upright and totally with it and with her parents, it was just such a special moment. And to be able to hug their necks and you know, say, hey, we got her through it. That was just really awesome.
There's not much that I can recall about my experience, but I do know I have battle scars to show it, that I did go through something tragic. And I'm very blessed to be here and show my gratefulness for every single person in here.
You're a miracle, and you're a miracle thanks to a lot of people in this room, and it makes our job worthwhile.
Yeah.
Seeing you here. This is the reason that we do this, is seeing you here smile at us.
We give our blood, sweat, and tears to these patients. And so when you know that this patient has gone home and they can go home and they can live their life as they would before, I think that's what really kind of brings it home for us and why we do what we do. You know, you can't save everybody, but the ones you do save, you want them to have a quality of life, and to know that they are, I think, is everything.